Good morning, everybody. I'd like to thank you all for joining us here today, especially our young people who are here from Otto Middle School who are actually consumers of our school-based health center. And you'll get a chance to talk to them in a few minutes. We are part of a network, the School Community Health Alliance of Michigan, of over 100 school-based and school-linked health centers in 31 counties across the state of Michigan. As Barb explained to you, a school-based health center is like a doctor's office in a school. We provide students with quality primary and mental health services in a safe and accessible environment, either in a school campus or very close by to a bus route or within walking distance of a school, so young people can access the services. Annually, we serve over 200,000 children at all grade levels from elementary through high school in urban, rural, and suburban school districts across the state. Our centers are primarily located in medically underserved communities where access to health care is a problem. We all know that just because you might have health insurance doesn't mean you have access to health care. So being located in a school is a critical access point. The Kids Count data book demonstrates that Michigan's economic success is tied to the educational attainment and to the health outcomes of our children and youth. We know that low-income children are more likely to face chronic conditions related to their oral, their mental, and their physical health, with particular concern these days of issues of obesity, asthma, and in many urban communities, lead poisoning. Students who are not healthy are distracted, have increased behavioral problems, and are frequently absent from school. We all know that when students are absent, they're not learning. So the bottom line, healthy kids learn better. The school health centers have a demonstrated track record of improving educational outcomes for students as well as health outcomes, and we are a cost-effective, evidence-based model for providing health care to students. Last year, a report was published by Michigan State University called the Michigan Evaluation of School-Based Health, or MESH. This study reviewed the impact of our school health centers on the health and health behaviors of our children and youth. The study found that school-based health centers are associated with a wide range of health benefits for the entire student population, whether the students access the health center or not. But it also is proven to improve the self-esteem of the student population. There's less physical and emotional discomfort. There's greater family involvement. I think Barb really highlighted the important relationship between family, student, and school. Greater physical activity, and kids are more likely to make healthy choices in the cafeteria with the foods that are there for them. In the data book, you'll notice that there's a particular focus on certain health conditions, asthma being one of them. Asthma is probably the most chronic reason for students to be absent from school. Roughly 1 of every 10 school children aged 6 to 17 in Michigan suffers from asthma, my son included. The symptoms can be managed with adequate medical supervision and support from the school. According to a study that was published a few years ago by the Henry Ford Health System and the University of Michigan, the school-based asthma care and management services that were provided improved student grade point averages by 36% in 1 year because the students were present, and it reduced the overall absenteeism of the entire school population. Behavioral problems can also impede students' success at school. All of our elementary school-based health centers are required to have on-site mental health services provided by master's level mental health professionals. And most of our adolescent health centers also provide mental health services, but we specifically provide prevention and counseling services to assist our students who may be at risk for depression, suicide, substance abuse, and other concerns. We know with all of the increased cuts that our state has faced in community mental health services, and quite honestly the chronic service of children in our mental health systems across the state, that these school-based mental health services are sometimes the only safety net for young people we are the means to protect and keep students in school. The disparities that are documented in the Kids Count data book bring to light the fact that health and education are intertwined. As our governor and legislature are going to be faced in the next few weeks with very, very difficult decisions about where to make their investments regarding education and health outcomes, I think we've demonstrated a good case that school-based and school-linked health centers are a unique bridge between health and the education sectors. We support educational attainment and we promote lifelong healthy behaviors of health choices. I thank you for coming to visit us here today at Otto, and I know that the students are available to answer any questions about how they access the health center, and I know that they're going to probably take you down for a few minutes and actually